here going to do some oral hygiene instruction. First, I'm going to do something with this disclosing solution. I'm just going to swab it all over your mouth, and it's just going to show me the areas that we need to work on for you, okay? All right, so I'm going to sit you back. Swish it around. All right, so now I'm going to seat you up, and then we'll just look over these specific areas for you. Perfect. All right, so go ahead and open up. So you see all these little pink spots here for you? Okay. This is plaque. And what plaque is biofilm. So have you ever heard of plaque or biofilm before? Plaque. Plaque? Okay, so I'll go into detail on what biofilm and plaque is. So biofilm is pretty much an organism that eats whenever we eat. It's a sugar-eating bacteria, and it causes acid demineralization on your teeth. So whenever it eats, it produces this waste product, which is acid, and it just sits on your teeth if you don't brush or if you don't floss, and it just kind of eats away at that hard substance, the enamel on your teeth, and that is the hardest substance in your body. So we don't want this process to happen, and whenever it does, it can cause future problems. So it can cause decay, which can cause cavities. We don't want cavities, right? No. So once you get a cavity, that can also, whenever you go to the dentist, you know how they kind of remove part of your teeth? They remove that decayed part, but sometimes they have to remove healthy teeth around it. So you're kind of putting your healthy substance on your teeth in a bad situation, because you'd have to remove it to get it restored, and that's for the cavity part. But for the gingival part, so your gums, biofilm does make it a problem as well for your gums. So if it gets deep into your gingival tissue, the longer it sits, it's kind of like a rock in your shoe. So that hardens and it becomes calculus. That's why you have to come see us, because we have to kind of get in here and get that calculus out. And the longer it sits in there, it's eating at your enamel, like I said, but it can cause some bone loss. So the longer that keeps going, it actually causes periodontal disease, which is bone loss. And we don't want any bone loss or teeth losing, right? No. So how we try and not make that happen is brushing our teeth and flossing, and just doing that on a regular basis, at least 2 to 3 times. because that'll remove that plaque biofilm substance that you feel after you eat, you know, a little fuzzy feeling, that's biofilm. So I'm gonna have you go ahead and show me how you brush your teeth. Very nice. Okay, so I'm going to show you what might be better for at least brushing your teeth. So you can still see, right? Okay. So we're going to angle it at like a 45-degree angle. And we're going to do little vibratory strokes and then roll down. Because even if we are having and using a soft toothbrush, it can still blunt our gingiva and it can still cause recessions if we're rubbing really hard on it. So we don't want to rub really hard. So we just do little vibratory strokes and roll down. Little vibratory strokes and roll down. And once you get to these front teeth on the top and the bottom, you can angle it a little bit like this. So tip it down towards your chin. Just do the same thing. Roll down. Same and roll down. And that's the same for the bottom. So you'll do that and roll up. And for the tongue surface, roll up. Do you want to show me again? Perfect. How does that feel? Good. Okay. Looks really good. All right, how about you show me how you floss as well? Okay. So you kind of get the gist of it. I see you're still trying to cup around the tooth, but instead, and if you want to roll up some of this extra floss, it'll kind of help it be less messy. And you'll just seesaw in between your teeth so you don't want to hurt your tissue. And you will do that little wrapping motion up against one surface of the tooth, and then you'll wrap against the other surface of the tooth. So you're making sure that you're getting both sides that you're flossing in between. Okay. Do you want to go ahead and do that one? Much better. That looks really great. And you're even getting off that pink stuff, which is biofilm. Good job. All right, so we're just going to go ahead and look at your charts. So here we have your perio charting. So your perio charting, like I said, was pretty much showing the growth of your tissue, if you have any overgrowth, or if you have any bleeding that's on the probing where I was poking your tissue. And then also any bone loss, which can happen with the biofilm just sitting there and just taking away that enamel substance. So we do have a few high numbers here, but I did see your medical history and I do know that you have epilepsy. So with that being said, considering you're taking Dilantin, that drug actually produces gingival overgrowth. So these numbers may be high, but there was no bleeding. So with that being said, it's not a disease problem here because I did look at your radiographs, so I'll show you these. So here are your radiographs. And normally if there was any bleeding on the probing, or if there was any deep pockets, sometimes it would be bone loss. And if you can see here, the bone is right at that, the top of the tooth margin. So it's showing that the bone levels are normal. So there's nothing wrong as in periodontal disease. But considering with the epilepsy and that medication, we're just going to watch it just to make sure that it doesn't keep growing, because if it does, sometimes that can entail of some surgical removal of just that gingival tissue, because overall you can keep more biofilm stored in there just because it is so much harder to get into that tissue because it's a pretty deep pocket still. So it's very imperative for you to brush your teeth and floss each day just because of the gingival overgrowth as well, because because if you do leave the biofilm in there, it can cause gingivitis or periodontitis or just anything that you don't really want. Alright, now let's go over here. And you didn't seem to have any habits that was wrong. I see that you do chew gum every now and then. So, what kind of gum do you chew?
Trident.
Trident? Oh, great. That is a sugar-free gum, at least most of the time. Just make sure on the label it does say sugar-free, because then if there's more sugar, you're just producing more biofilm, and then it's just making the problem occur more and more. And do you drink any soft drinks at all?
Coke.
Coke, you do? Okay, so with the Coke, you would like to wash it down with some water after you drink some of the Coke, because that Coke is acidic and it's producing the biofilm and it's giving the biofilm even more acid, so then the biofilm is just at its attacking time. So in order to just minimize the biofilm's attack, you just want it to wash it down with some water. It'll kind of dilute the whole process and make it just less aggressive. And then you also grind, is that what's going on as well? So with grinding, do you have any pain in your jaw?
Yes.
Okay, so with that, we can possibly try to get you referred for a night board, because then that will minimize the grinding at night, and then it can also help with your jaw and giving it less trauma during the nighttime as well. Do you grind during the day? No? Okay, great. Make sure you don't grind during the day because you don't want that. Alright. Okay, so overall, how often do you brush?
Once a day.
Once a day? Okay. And then how often do you floss?
Never.
Never. Okay. So after talking and kind of hearing about what biofilm can do, especially with your gingival overgrowth, do you think that you're going to try to brush more often? Okay, just because we don't want you to get any diseases or even more overgrowth. And sometimes that gingiva can overgrow so much to the point where it's on top of your tooth and you're biting on it. But that can be the worst case scenario. We don't want that for you as well. And so with the flossing, especially because of the gingival overgrowth, like I said, you really want to floss as much as you can. So at least once a day. I understand it's sometimes very hard, and sometimes it's hard for me as well. Don't worry, you're not the only one. But I do think that if you can try to get it to maybe a couple times a week and just progressively add maybe once a day or, a couple more times, just so you can kind of get in the flow of getting the flossing in there, then that'll help. And you might see some bleeding, and that's okay. It's normal. It's just your body is reacting in a way that it's not used to you flossing, so it's just kind of crying for help. That's what's going on. So don't be alarmed when you see blood. And I am going to show you a couple pictures on what gingivitis looks like. All right. So let's put that. Okay. So this is overall what we want to see in our radiographs and in our clinical form. Right here is a healthy tissue. So you remember when I was poking around and just trying to find a couple measurements? That's called probing. And that's what this is here. So that's a probe. And that's just measuring how far your gums go down into what we call the sulcus. So it's just that little pocket in between your gums and your tooth. So we're pushing, or we're just lightly tapping our probe in to see what the measurement is, and normally it's about 2 to 3 millimeters of pocket depth. And with that, you see how the gingiva is very tight and it's very healthy and it looks pretty pink? That's how the gum should look. Although we know with your case you do have the gingival overgrowth as well. This may be the normal generalized, but your normal is a little different just because of specific medications. So don't be too alarmed. And then we have gingivitis. So you see how this is a lot more red? Your tissues aren't too red. So you don't have gingivitis. It's just the overgrowth. And with this, it's just a little bit deeper than the last picture, but it is also just very inflamed and it's just kind of crying for help, like before when I said what's going to happen with flossing. And then we've got, this is earlier periodontitis. So the pocket is going to be much deeper. So last time it looked like the bone levels were pretty high on this side, but now they're starting to decrease a lot. And that is because of the biofilm production. It was just eating away at your enamel, and then it got into the actual tooth surface, and then it started eating away at the bone around the tissue as well. And here is moderate periodontitis. So with moderate periodontitis, and periodontitis in general, it is not reversible. So once the bone is gone, it can never come back. But with gingivitis, that is reversible. It's just an inflammation of the gums, like how red it looks in that last picture. That can be reversible because that can change with your brushing habits and your flossing habits. And coming to see us, we can clean it for you. But if you want to minimize it the most, it's just doing it on your own by brushing and flossing daily, twice a day. So this one's the moderate, and then we have advanced periodontitis. This is what we really do not want to ever see. This is the worst case scenario where it's just the entire bone of the enamel on the tooth is almost gone, and that's the root. So your tooth would be very sensitive, it would be very upset overall. And the pocket depths are very deep, and this bone level would be very low as well. So this is worst case scenario. We don't want to see this ever, but you know, sometimes it happens. It's just because people don't brush or floss on the regular day. Alright, so if you want, I'm going to have you show me one more time just to make sure that you didn't forget it on how to brush. Does that feel okay? Perfect. Well, thank you so much. Do you have any questions for me? Nope. Well, I hope that you can improve your gingival health, and we'll be here if you have any questions.